student nurse today.
Hi, my name is Mark Picard.
Hi, so can I get a report about your patient?
Yes, the patient is a 67-year-old African male. He's married. He was brought in with primary diagnosis of a stage 2 pressure ulcer on his heel and secondary diagnosis of diabetic mellitus. He is currently experiencing problems with high blood sugar, and we are combating it with insulin shots.
Okay, cool. So why specifically is the client receiving the medication?
He is having trouble controlling his blood sugar, and because he's diabetic, his pancreas is not producing the insulin he needs, so we must introduce it artificially.
Okay, so what action exactly does insulin have on the body?
It, simply put, takes glucose that would normally be taken in by the pancreas. It takes the glucose and brings it into the body.
Okay, so when should you question administering this medication?
The medication should only ever be administered if it's within a certain range. If it's administered and it's normal baseline, he could go into hypoglycemia.
Okay, so does it have like a therapeutic range then, this medication?
Yes, you just have to refer to the sliding scale and make sure you follow it strictly, because the sliding scale has been tested thoroughly.
So what vital signs should we be monitoring?
Well, the 5 vital signs are the pain, pulse, respiration, temperature, and blood pressure.
Okay, so what physiological parameters should we be monitoring?
Always watch for signs of anaphylaxis or difficulty breathing, because this patient may have allergies that he is not aware of. Sometimes people can develop allergies later in life. Make sure to watch for signs of hypoglycemia. Hyperglycemia indicates that the medication is, God forbid, skipped and his blood sugar is left to skyrocket.
Okay, cool. So what interventions should the client be taught to make sure that you're giving the medication to him safely while he's here in the hospital?
Well, in the hospital, much of the work will be done for him, but the nurses will need his help in verifying the last injection site. So I would suggest that just tell him to remember the last injection site, because we need to keep rotating.
Okay, so what interventions should he know about when he goes home?
Well, at home, if he is using NPH and regular insulin, he needs to know the proper way to mix it. The proper way to use a sliding scale and using Accu-Check to measure the amount of units he is to give himself. And as I said, with the rotation of the injection site, so the scar tissue does not form. And importantly, for him not to keep using the same needle, because oftentimes patients will try and do that to save money.
Okay. So what are some side effects or potential adverse reactions?
It says allergies, anaphylaxis, hypoglycemia, if it's not measured properly or given too early.
Okay, so how will we know that it was effective?
We're just going to take a simple Accu-Check and measure his blood sugar.
Okay, cool. So I don't have any more questions. I guess we should go do this.
Okay. Hello, my name is Mark Picard. I will be your nurse. Can I have your name and date of birth, please?
Yeah, it's Litzberg. 1150.
Okay. Cool. How are you feeling today?
Feeling alright.
You have any pain, concerns?
No pain.
No? Have you eaten today?
Yeah, I just had a meal.
Okay. Let me go get some gloves. Are you aware of the signs of low blood sugar?
All I know is that if I have low blood sugar, I feel a little bit tired and weak, a little bit fatigued. Is there anything else I need to know about?
Well, if you do start to feel that, and if it gets progressively worse, what I suggest is taking a candy bar or maybe some juice, anything with sugar, and eating a little bit of it until you start feeling better. It'll bring your blood sugar up, but just in case you do. Okay. You'll be receiving 2 insulins today, NPH and regular. We have to verify the right medication. Let me check tomorrow. And just so I can verify, can you give me your name and the date of birth again, please?
Yep, This Greg? 150.
Last name?
It's Greg.
Right medication, right patient. We are at the right time. Dose for the NPH is 20 units, and because your most recent AccuCheck was 290, we'll also be giving you 6 units of the regular insulin. Do you have any allergies?
Nope. No.
If you do feel or start feeling short of breath or any kind of the common signs of an allergic reaction, you can do hit the call button immediately. A nurse will come to assist you. There should be. Will be given to you subcutaneously.
Could you guys do it on the other arm this time?
Yes. What was your last injection, sir?
With my right arm.
Okay, so left
Oh, you can't take it off until it reaches 80%. Oh, really?
And we'll be giving you 20 units. I'm gonna need you in a second, student nurse. Please verify this is 20 units.
Correct.
Please verify that this is 26 units. And just to double check again, we are doing it on your right arm. Grab the injection site. This is Ms. Sharps. Okay. Alright, I'm going to make sure it was given in the arm. I'm going to scan your bracelet.
I really want that thing. I just set it down like it was. Mom was gonna walk out or whatever. Nope. Maybe we'll mix the wet my favorite.
Are there any other questions you have about the procedure?
No, when do I know it's working?
The nurse will take an AccuCheck for you, and we'll measure your, blood sugar levels to make sure it's working. If you've been feeling tired or sluggish because of the high blood sugar, you should feel better in a few minutes. Let me see if you wash my hands. No more concerns, questions? Anything like
No.
that?